Welcome to this session of the Intuitive Medicine Summit, where we'll explore ways to intuitively participate in our own healing. I'm Lisa Bonnies, your host, and my guests for this session are members of the National Organization for Medical Intuition, also known as Nomi, whose advisory board is made up of healthcare and industry field leaders. Our topic today is bringing medical intuition into healthcare. Let me start out by introducing our panel. First, we have Wendy Coulter, Nomi President and Board Chair. Next, we have Dr. Tiffany Barsotti, Nomi's Vice President and Vice Chair. Dr. Maria Gentili, Nomi Treasurer. Kay Randall May, PhD, is a founding board member and secretary of Nomi. And Elizabeth Thorson, Nomi Director, is trained as an RN. Whoa, thank you all for joining us. This is going to be a great conversation. Welcome to all of you. Yeah, well, you know what, Wendy, let's go ahead and start with you. Definition of medical intuition. What is it and what is it not?
Well, medical intuition, there are many forms of medical intuition, many ways to practice it. Our definition at Nomi is that it is an intuitive skill set designed to assess the physical body and the biofield. And what we're looking for are energetic patterns, anomalies, issues that could cause or lead to health issues. We can look at the underlying causes physically, we can look at the underlying causes emotionally, mentally, and spiritually. Now, what it is not is any kind of medical treatment, diagnosis. It does not take the place of medical care, that it is not an intervention, it is an observational assessment skill.
So Tiffany, would you please tell us about Nomi specifically, its mission, its vision statement?
Yes, thank you. We are thrilled to be working together on such a thing. And we really envision a world where medical intuitive practitioners are accepted in a clinical healthcare setting, also in private practice, that we make a membership organization where we feel supported and be able to share findings and share, obviously, for the betterment of our whole field. As far as our mission, we're really dedicated to the advancement of the professionals that seek to have a career, also be of service in this way. We really are striving for the assurity of safety, of well-being in the public domain, of making sure that it's accepted as a skill by working within the appropriate scopes of our practice. This is, creating national standards as a goal, promoting ways of ethical conduct, being able, like I said, sharing and just creating a community, and really working towards integration, how it is that we can be of service to medical professionals and that they see the value of being able to invite us on their team. Also to facilitate research.
Maria, would you maybe share with us how can medical intuition be integrated into the clinical environment? Because that seems to be the biggest challenge at this point.
So when a patient comes into your office and starts discussing their symptoms, a doctor will start to formulate what is called a differential diagnosis. Think of it as a list of possibilities. What medical conditions could be related to this list of symptoms that the patient is giving you? Sometimes the scope is very narrow and it's very easy to make the diagnosis, but sometimes the case is more complex and it involves a bigger list of possibility and multiple systems, so heart, lungs, kidney, and it's more difficult to diagnose. Then we start to rely more heavily on physical exam and various testing to narrow down the cause. This could be quite costly and time-consuming for a patient. So if we could consult with a medical intuitive, or better still, have a medical intuitive in our practice, we can use the medical intuitive skills to help narrow the scope, leading to more focused testing. This translates to less cost, time, and effort for the patient. It also helps the doctor reach the diagnosis more quickly so that the patient gets the right treatment earlier. We become more efficient, and this leads to improved patient satisfaction.
And, I'm sure Maria's had very much the same kinds of experiences that I've had. Like if I'm in triage and somebody's coming in, because I was an ER nurse for many years and always worked in critical care, and I would know who wasn't going to be in the ICU the following day when I came in. I would know who wasn't going to make it out of the OR the following day. And that was some years ago. And if I would share that with my peers, they would look at me like I had 5 heads. So of course I learned to keep my mouth shut. But I have found that the whole working in a medical arena with my background and as a medical intuitive, it's a perfect laboratory. So if I was in triage with somebody who came in with bumps and bruises and they say they fell over the child's toy, I would see they were pushed down the stairs. I would go a very different route. I would get that image in my head. I would go a very different route with that patient. I had a situation where a woman in her 80s came in with stroke symptoms. I tapped into her and they gave her the clot busting drug and all of her symptoms resolved. But what I kept seeing was this sort of dark stickiness in her brain. And I'm like, okay, we've taken care of the stroke, we've taken care of the clot that was causing the problem. And of course, with the clot busting drugs, one of the problems is bleeding afterwards. And I found out the next day that she indeed did have a cerebral bleed in her brain, and that I had been seeing it before it actually was happening.
Well, let me ask you, Kay, does a medical intuitive have to be a medical professional? Because Elizabeth was right there in the room, but some folks, they don't have medical training. Is it necessary?
Absolutely not. I believe that medical intuitives do not need to be trained specifically in medicine. I myself have my doctorate in entomology, primarily in comparative anatomy and physiology, both invertebrate and vertebrate. I do believe, however, and I have stressed this with my students in the past, that a person should have an understanding of the physical body. However, I have also known of many medical intuitives who are picking up on images and emotions which are not necessarily physical. As just an example, I had an individual in my office a few years ago. His primary problem was a problem with his shoulder, which did not heal. And when I connected to him, I did not see the shoulder issue. Instead, I saw a bicycle. And so I told him that I saw a bicycle. And what did that mean? And he said that he himself was a physician, and then due to the pressures of his schedule, he wasn't able to do his biking like he loved to do. It was the issue related to the lack of the biking, which was giving him difficulty. So I suggested that he go ahead and allow himself some time, and he decided to bike his way to work. And as he did so, his shoulder healed. And so not all of the impressions that people receive are specifically physical.
Now, I understand that Nomi has done a national survey on medical intuition. What did you discover? Wendy, would you like to start out?
The survey was our first big effort before we were actually formed as Nomi. Nomi was just recently formed as a nonprofit. We decided that we needed information on what medical intuitives do and how they do it. That information doesn't exist in the literature, the scientific literature. Tiffany, did you want to talk about what and why we did this?
It was actually just to survey our other professionals out there in the world and to see what their experiences are. The survey that we did it still needs to be running, honestly, because there are more people that are willing to hang a shingle now who are coming out. The esoteric is really being made exoteric, and it's prime time for this kind of thing. We're making some changes to the survey, and we will be putting it out there again. But once again, the primary look is into the practices of people who call themselves medical intuition practitioners or professionals.
Maria, would you like to share some of the data that we gathered, which we found very illuminating and frankly, data that has never been seen before?
So what we found with the survey was that 82% of medical intuitives assisted licensed healthcare professionals with their patients and clients. 43% directly assisted physicians, naturopathic doctors, and allied health practitioners like physician's assistants and nurse practitioners. 21% assisted mental health care providers like psychologists and therapists, and 18% assisted licensed complementary and integrative practitioners like acupuncturists, chiropractors, and licensed massage therapists. 86% of medical intuitives received referrals from the licensed practitioners that we just mentioned. 30% of the medical intuitives identified as licensed healthcare practitioners themselves, including physicians, naturopathic doctors, physician assistants, nurse practitioners, mental health professionals, and integrative practitioners. 65% of the medical intuitives received formal or mentored training in medical intuition. 76% reported strong positive interest in a national organization to create standards of practice, which Nomi hopes to accomplish.
In a time when science seems so very polarizing and we really do value evidence, what does medical intuition bring to the notion of whole person healing inside the worldview of medicine?
There's complexities in that for sure. Aristotle said the sum is greater than the whole of its parts. And it was really at that time when Aristotle put that out there when Western medicine was actually coming online. And we got into naive reductionism. We started looking into parts, and we aren't just parts, we're multiple systems. It's interesting because NCCIH, which is the NIH's complementary integrative health arm, they actually put out a report recently on their white paper on whole person medicine and whole person health. And it was interesting because they included for the individual biological, behavioral, social, and environmental. But behavioral is not the same as spiritual and psychospiritual, emotional, energetics of our whole systems and the way that we live. We really, it's more inclusive. I think that this is where we have the chance to be able to, once again, bringing in intuition, not just from an outside perspective coming in from a team, but also encouraging the physicians to be able to use their intuition more and to trust themselves. So that's something that Nomi is actually seeking to do more of.
Let's talk about Nomi's goals. Tell us what they are.
Standards of practice and ethical conduct, best practices in medical intuition, very important discussion. It's been a bit of a wild west out there. You know, people practice whatever way they've been taught or whatever way they've learned themselves. We'd like to have a national discussion about this and talk about establishing these standards. A community for medical intuitives is really important. Many medical intuitives operate kind of singly. So a community where we can really bring forth these conversations is of great value, we feel. So we are going to start with outreach and membership building. We want to establish a database of people interested in this from the healthcare field and also the practitioners, allying with healthcare organizations. If anyone listening and watching this summit feels that this might be of value to their clinic or their environment, please do reach out to us. Also, continue to develop and implement clinical applications of medical intuition. For the public, our goals are to create partnerships, again, with organizations, to outreach, to allow, we're looking at into the near future about creating a database of medical intuition resources, research, vetted practitioners, things like this, and really just generating articles, awareness of research, use of medical intuition in healthcare. The website will be a resource point for everyone, the public and healthcare providers, as well as medical intuitives. And those are our starting goals.
Again, I want to make sure I mention that website again. It is medicalintuition.org, easy enough to remember. And I want to thank everyone for joining us and the members of the National Organization for Medical Intuition and their advisory board. I hope you enjoyed this conversation in the Intuitive Medicine Summit.